Hello, I am doing this video basically to kind of catch everyone up on what is going on with my health. And this seemed to be an easier way. Plus, like I said, it's much easier than having to repeat myself over and over and over to let everyone know. And also because there are people out there who are going through similar health issues. And if this can kind of help at least one person, then that would be great. So most of you know that I've been going to the Mayo Clinic lately. Just to backtrack a little bit, and just in case you don't know, so with my history, I have had 4 cardiac ablations in the past, which is where they get a catheter into the main artery in your leg, groin area, up to your heart, and they're watching everything, and they basically would induce these arrhythmias that I'd have, and then they cauterize them, burn them, to try to prevent the arrhythmias from coming back. So I've had 4 of those done. And then I have aortic insufficiency. So in 2011, I had open heart surgery to have that repaired. Basically, the valve was supposed to pump like this, and mine just kind of would go like this, and the blood would backflow into the heart, stretching it out, causing a lot of issues and not pumping properly to the rest of my organs. So they were able to repair it. I guess there was a tear in the valve, and they repaired it for me. And so that was 2011. And then I've been having bradycardia, which is a slow heart rate, tachycardia, which is fast heart rate, and everything in between, arrhythmias, you name it. So basically and I guess it's been a little over 2 years now, they put the pacemaker in. And before I got my pacemaker, they had the heart monitor on me. They were able to see that my heart rates would drop into the 30s. They were consistently sitting in the 40s. So as I'd be talking, walking, whatever, my heart rate would be in the 40s. And then sometimes, like, if I'd go from sitting and standing, it would like triple. So I'd be like 40s, and it would go, even up to the 150s. So where I'd be sitting there and it would go into a crazy arrhythmias. So they had diagnosed me with sick sinus syndrome, which is basically the dysfunction of your natural pacemaker, the sinus node, along with, like I said, the bradycardia. So the pacemaker has helped me tremendously. I'm so grateful for that. My heart rate would fall so low in my sleep that I would wake up in arrhythmias. And what makes me like a unique case too is that I have Ehlers-Danlos syndrome, which is a connective tissue disorder. Our bodies are made up of 30%, of connective tissue. So when you have a genetic mutation in the collagen production that makes up 30% of your body, you're going to have a systemic effect and, a lot of health issues from that. So with that, I do have a lot of health issues. So the thing about Ehlers-Danlos syndrome is like the umbrella, and all underneath that you have a lot of health issues. So what makes me a complicated case is that I have this sort of rare genetic disorder, the Ehlers-Danlos syndrome, which they're finding lately is more rarely diagnosed. And so before I was diagnosed with that, I also was diagnosed with the WPW, which is kind of a congenital heart defect, what was producing all those crazy arrhythmias where I had 4 ablations for. So because I had that one that was kind of rare, they didn't think that I had another thing that was kind of rare. And so what happens when you have an issue, people focus on that issue. So even before I found that my valve was leaking, everyone was focused on the arrhythmias that I had those ablations for, and they weren't looking at the anatomy of my heart or the valves, because this was an arrhythmia thing, not an anatomical thing. So it's easy for those things to kind of get dismissed and go under the radar. And so continuing on, now I have the diagnosis of Ehlers-Danlos syndrome, which again is like the hypermobility in your ligaments. So like with the joints, they're all crazy. It can pop out my shoulders and hips and stuff. and that also affects your organs, not just your joints. So now I'm still having these issues. And when I saw the geneticist who, officially diagnosed me, his thing was that there's got to be something else going on, because though I do have a lot of similar issues that are caused by Ehlers-Danlos syndrome under that umbrella, I also have some cardiac issues that are not normal for Ehlers-Danlos, and they're a little more extreme. So to go into what is happening, basically, I would say about once a month I end up in the ER. Sometimes more in the past, but every single day my fingers and lips and sometimes tongue will go numb and tingle, probably about maybe 15 times a day for a couple minutes, every day. And some days it gets worse, and the tingling will spread to my whole face, my head, and the tingling in my arm will spread to pain, and then my chest will get tight, and then my heart rate and blood pressure will shoot up. And it basically feels like I'm gonna have a heart attack. And so when I go to the ER, basically they say, you're too young to be having a heart attack, and I don't actually have the heart attack, so my troponin levels are good. Therefore, they dismiss me and send me home. So because I have Ehlers-Danlos syndrome, I also have a dysfunctional autonomic nervous system, so my digestion can be crazy and wonky. Having that blood pressure issues, the tachycardia. So what makes it so confusing is that it's, sometimes it's like, is that what's going on? Am I just having a dysfunctional nervous system today? And is it going crazy? I'm in fight or flight mode, or not. So when those symptoms get a little more severe like that, it's not quite, I guess it just become kind of a mystery. So, am I really on the verge of having a heart attack, or what's going on? Because it seems a little bit different and more so than the typical dysautonomia episode. And so one of the things is 2 years ago because I've been having all these symptoms, I had a stress test. So with the stress test, you're on you're laying down and you're like moving the pedals on a bike and basically trying to get your heart rate to a certain point, and they're monitoring your own EKG and your blood pressure and all that. And what they're looking for is if you have a positive stress test, which would show ischemia. Ischemia is like the lack of oxygen, to the heart. And so it can show on the EKG strip with T-wave abnormalities. So that's like the last little bump. And sometimes they'll dip under. And that kind of will signify ischemia. And so basically when I had the test, which I asked for the test and was given the test because I was explaining my symptoms, I said, I can't overexert myself. I have these symptoms all the time. So it was like, well, let's see if this is truly happening. Well, it was positive. They had to stop the test. I had the symptoms. I had the clamminess in my fingers. I had, the T-wave I can't think. My T-waves were inverted. Everything was crystal clear that it was a positive stress test for ischemia, noted also in the report. And then when I showed my doctor, he kind of was just like, it was like, hey, this is my proof. And he was like, no, there's such thing as false positives. And I feel like that's what you had because this isn't normal. So again, here I am being dismissed, even though I have the proof with the test, and it's not enough. So that was 2 years ago. I'm still having these issues. I'm still going to the ER every month. I'm still having these episodes, these scary episodes, where I'm literally like praying for my life, like, please don't die today. And so going to the Mayo Clinic, I had all the tests done. They did a CT angio, which is like a CT scan. They put the contrast dye in to see everything that's going on. So, my heart echo was okay. It showed that in the last 6 months, my aortic valve went from a mild aortic insufficiency to today, which is moderate. So there's definitely an increase, because before that was mild, so was mild. So then it went from mild to moderate to moderate. So in these 6-month intervals, it's increasing. And so usually at severe is when they'll do open heart surgery and repair it, but I'm not there yet. So they kind of want to push it off maybe another year. Well, the blood work I had done shows a hormone that you produce when you are going into heart failure that was elevated. However, it's not elevated enough to say I have heart failure. It's just showing that basically what we're doing is we're using it as a baseline. So when I take it again and whenever I do my next echo, 6 months or a year or whatever, then they would see if that number is increasing, and if it is, and it's showing that I'm, you know, continuing to lead into the heart failure. And so now basically my main update is the CT scan. So the CT scan, and don't even ask me how I have this. I shouldn't have this. The CT scan shows, so right here, the red is the coronary artery, or the LAD. So my CT scan showed that it's called a myocardial bridge. So basically this artery right here, it's on top of the heart, as you can see. And so a myocardial bridge means that this muscle, the heart muscle, goes on top of it. And which is why they call it the bridge. So it's not on top, the muscle's on top and it's underneath. So as your heart is pumping, it causes constriction in that artery, which is a pretty big, important artery. So what they have found in the past is that it is sort of common for minor bridges to be found, and most people don't have symptoms. However, it all really depends on the bridge, how significant it is, how long it is, how deep under the muscle it is, and of course, the pressure and the constriction and all those numbers. So mine is a long segment, meaning that it's a longer segment of it is underneath the muscle. And so I think originally my doctor, you know, was trying to sort of brush it off, and which is probably why in the past this maybe hasn't been discovered, is because they probably just brushed it off. And part of that reason is because not a lot of doctors are super knowledgeable about myocardial bridges. In fact, the research I've done, everyone goes to Boston to get the procedure, the open heart surgery, or they'll go in through the rib, and it's called unroofing, where they take the muscle off over that artery. So, you know, when I was talking to my doctor and we went over my chart, and he remembered that I did have that positive stress test for ischemia, which kind of ties in with that. And then to throw on the factor that I have also an aortic valve that is of concern that needs surgery in the future. If you combine the two, then that can make things more symptomatic, more, you know, or make them worse. So with that being said, my next step is to do a heart catheterization, which is where you go into the cath lab and, you know, you're laying on a table, they sedate you, and they put the catheter, again, like I said before, in the groin artery, and they go up to your heart, and they're looking at it, you know, on the screen. They get better imaging. And then they put like a wire piece into the artery, and they test the pressure, so they can see with that, you know, how much constriction I'm having at rest, and kind of get a better picture of, you know, what's causing, if this is really truly what is causing these issues. Because the symptoms of a symptomatic myocardial bridge is that feeling that I'm having, like you're going to have a heart attack. Some people actually have had heart attacks because you're getting so much constriction. One of the guys who is in the group, I saw his video while I was doing my research, and he was a high school student. I think his name was Paul. And he was saying that he had 40% constriction at rest and almost up to 80% when he was being active. And what happens is, you know, you have like I said, the heart attack like symptoms. And of course you're tired or you're exhausted throughout the day. I mean, your body is basically not getting enough, you know, you're not getting enough oxygen to your heart, to your organs. And so some people have had really great results when they've had the unroofing done. They feel like they've gotten their life back, and I'm hoping that this could kind of help with my quality of life. So, you know, the sucky part is that there's a good possibility that I'll need the surgery sooner rather than later. But the good thing is that, like I said, hopefully I can get some quality of life back. And, you know, I know a lot of people see me and I seem normal, and, you know, but, you know, it's to have to live your life to go to the ER at least once every month, to go to the ER thinking you could possibly have a heart attack or stroke is scary. And I wouldn't wish that on anyone. And again, it's every month. I actually counted in the last 2 years, which was 2017 to 2019, not including the rest of 2019, but in those 2 years, I have been to the ER 52 times. And, you know, I don't think that that's a way anyone should have to live. And to be, like I said, to be dismissed. And, you know, a lot of times when I go to the ER, it's almost like I get laughed at, like, you know, you're not having a heart attack. Like, I'm not your typical heart attack patient, you know. I'm in my 30s. I'm not, you know, overweight. You know, I don't smoke. You know, my cholesterol's okay. So, it, you know, to, like I said, to be dismissed and to be told, like, you know, oh, maybe it's anxiety, despite having the history I have with my heart, you know, I still get dismissed. So, in a way it's great because I feel like, you know, I'm getting answers. Like, this is huge progress in part of my health journey, to find this out, because like I said, you know, this could make a big difference. It's what's frustrating too, and I guess, you know, my point or something I want to share to other people is, just because you might have a diagnosis, that doesn't necessarily mean like that's the end of that book. You know, like, this is my diagnosis, we're done. That might be the end of that chapter, but there's so many other chapters, and you don't know if there's something that might be causing that diagnosis, or perhaps, you know, maybe there's something else. Because like I said, with Ehlers-Danlos syndrome, it creates such a mess. There's so many issues. You know, you have IBS, you have the dysautonomia and POTS, and Raynaud's, and I mean, there's so many things that really could kind of tie it all together. And I could have just said, you know, this is Ehlers-Danlos syndrome. But again, my geneticist, you know, he reminded me and made such a valuable lesson, which was that you can have more than one thing. And so because of that, I feel like that's why I kind of kept pushing, like, okay, then what else is it? This isn't caused by Ehlers-Danlos syndrome. Why do I have all these issues? And again, you know, I could have just, you know, chalked it up to the fact that, well, I have these arrhythmias from the WPW, Wolff Parkinson-White syndrome, which is what was the extra bypass tract in my heart that caused these arrhythmias. I mean, that's one thing. Ehlers-Danlos syndrome, that's another thing. To have a myocardial bridge, which is, you know, another congenital anomaly, that's a whole other thing. So it's like, it's crazy, I guess, to find that there's all these multiple things. But I mean, really, at the end of the day, I think if anyone were to just be truly head to toe looked at people are going to find some weird things. So, and some of those things might be kind of crazy or scary. I mean, there are people who have leaky valves and don't even know it. So at the end of the day, really what matters is if this is something that's symptomatic, if it's something that affects your life, and in my case, it is. And so that's where we're at right now. Thanks for listening. Hopefully I didn't ramble for too long. So, you know, like I said, the next step is to go to the cath lab and have that procedure done so they can get a little more information. And then we'll go from there. So I also want to add a note that, you know, never mind, I'm not going to say that. I was going to say, just like if I were to have, I guess, open heart surgery, I would try to plan it for later because holidays are coming up, and if I dealt with this for, I know it's getting worse, but I mean, I don't think a couple of months is going to hurt. So I'm definitely, what I'm trying to say is I will be fortunate enough to hopefully be able to schedule around this, and so it won't affect any plans or commitments that I have made, which I was able to do last time I had open heart surgery. Last time I had open heart surgery, I was able to plan it a couple months later because I had some weddings that I had to do and was committed to, and that schedule-wise it worked out great. So I believe that I would be fortunate enough to be able to do the same as well, which is great. So yeah, that's it for now, and I guess stay tuned. I'm gonna get the cath done at the end of October because we're about to move. It's Astrid's birthday, and I know it's kind of a minor procedure, but technically it'll be my 6th, and I do have a reaction to the CT, so I have to pre-medicate, and I want to be able to relax and rest after, because I know in the past how I felt after, and for me, I did not feel well for a couple days, even though I don't know if that's necessarily normal, but given my other issues, maybe it is for me. So I just want to be able to know that I can rest for a couple days, so I didn't want to have to deal with moving and have it, you know, affect like her birthday and stuff. So the October 28th is when I'll have the procedure, and then we'll find out from there. So thank you very much. Let me know if anyone has any questions or if they've been through anything similar. And that's all.